BASAM, like you rightly said, was established a few years back with the aim of improving the health status of mothers and children. The membership comprises the civil servants who are stakeholders in the Ministry of Health and other health-related agencies, civil society organizations, unions, and other relevant stakeholders.
Each and every quarter, the CSO coalition and the BASAM used to assess the government and advise the government in a proper way that we can make impact in the life of the citizens of Bauchi State.
First of all, we know how to advocate to the government partners, especially on the budget allocation, time releases, and then also good qualitative service delivery. So we learn how to monitor service delivery by virtue of working with BASAM. We also learn how to monitor and even assess the state commitment toward providing services on those three key areas of BASAM thematic areas. That's family planning, nutrition, and then MNCH.
We are doing scorecards to evaluate what government is doing, how much government has released for the program, and what that's supposed to advocate to government so that they can do the right things to the people that elected them.
Since the situation of this country has deteriorated so much so that the government is not able to discharge its responsibilities as at when due. It needs private hands to come in. We really needed that push, external push, to really make things work.
Even when during our health summit, BASAM was involved. The health summit was conducted in Bauchi State. Their concern is what is the major problem of healthcare in Bauchi State is human resource, number one, and facility infrastructural decay. So, and that was the reason why I'm so happy with BASAM.
We use the media to tell what those other committees are doing and what BASAM is doing to create demand and to also create awareness and to also hold government accountable.
Before the coming of Mama, many people, I will start from the civil service, people don't even know from the civil service perspective, because I've been in the service for 3 decades now, so I know that it's not usual to ask questions. What is your budget? What are you doing with it? How did you spend it? On what? Why?
We make the government adopt an Abuja declaration of the health sector that they should maintain at least, or they should give at least 15% of their total state budget to the health sector. That BASAM has worked tirelessly to see that Bauchi State government has engaged, the Bauchi State government has adopted the policy, and they have done that for about 4-5 years back. We have been on it. As part of our successes, Bauchi State government now adopt 15% Abuja declaration.
In 2019, when the state government during its budget, they ignore, or I can say, the script of family planning, their budget allocation, or even budget allocation, but due to intervention and the series of advocacies and the media engagement, family planning budget line was brought back into the primary health care emergency budget.
If I'm the one to summarize the BASAM, I can say they are the life saving of Bauchi State because they are up to the core that in any time, any minute, with the government and intimidating government to do the right things. They are always advocating for transparency and accountability in all aspects of the government.
One of the main things that made us to have a headway is our approach. We don't conquer fact, we don't conquer evidence. We collaborate based on facts on ground. And government has seen this fact that is coming from them.
And they even have a sort of way of scoring those things on their own, particularly the budget side. They score the budget of each facility, how much was spent on maternal, newborn, and child health care, nutrition, and issue. That's very important to us. Even I showed them we were doing our scoring. Look at our maternal and child health care scoring here. For fourth quarter is there. They show me their own. They say this is our own assessment and this is our own work. And they actually do their homework. It's like they do a separate work that look at issue of quality of our healthcare system, both the PSCs and the other activity of maternal, newborn, and child health care. The scorecard is telling us that we've been given this budget. Last year was 12.5%. How far have we spent the money? How far is your performance? And how much have we spent on issue of maternal and child health care? How much have we spent on nutrition? How much have we spent on immunization? How much have we spent on the issue of whether gender-based violence? So the scorecard is quite clear, different from our own scorecard. They look at budgetary provision, performances, and that was the reason why I was saying that we are doing this thing as our scorecard. Our scorecard is telling us about how many human resources do you have, and then how many people have received first pentavalent vaccination, complete third dose of pentavalent vaccination. How many people have received vitamin A? Our own is showing that their own is, they are looking at how much money we are giving to you. How much have you spent the money? Were you been given? Was there any release? So that was the importance of that particular scorecard of BASAM has helped us in looking at that. We didn't even know sometimes the lot of PRS of the Ministry of Primary Healthcare is not helping me, is not helping the matter. But the BASAM will dig out those things that are hiding. And then I will know that we are not performing in this way. Why don't you do more on this side before they are ended? So that our performance will be more and then we'll get more budgetary allocation.
Government have a lot in their hand. They have this other sector to look at, they have the political sector, they have a lot of sector. So the health sector, where our concern is, we now feel that it needs of serious government attention. So the only way we can do that is by lobbying, by persisting, by being very close to the government, and that has been really leading out. We cannot sit down and say, okay, maybe we do it quarterly or biannually. It will not really yet to what you really want.
When you go to the government partner and they give you information, you report the information the way it is. No addition, no subtraction. So when you tell the story the right way, you build trust among the government partners. And then when the CSO say, this is what we are saying, this is what we are advocating for, you do it with no bias.
Because I know some CSOs that this ministry in particular, budget and planning, stop inviting them for activities because of their outspokenness. I know of that. But BASAM is not. It's not among those. Because of the diplomatic skills.
I've learned that it pays to work as a team. The team must not be a very big one. A team of 4, a team of 5. You can do exploits with that. As long as the people are willing to encourage one another. When I'm saying, I'm getting tired, my friend might say, yeah, how could we let's do it, let's do it. Or if you don't say, yeah, I'm not going to say, don't worry, let's do that. That way, we keep giving each other strength.
From the beginning, we find it's not easy, but with the training we received from Mama E4A, the support, we have been trained constantly, repeatedly trained on budget formulation, budget tracking, and so many other aspects of the budget, and how we will now develop this scorecard.
I would like to commend E4A Mamae for the initiative. Actually, at the beginning, we were doubting if the goals and objective of the program can be achieved. But to God be the glory, we are part of the team that take the goals and objective of the IFOMI to a success level.
Recruitment of the health workers has just been started, because for the past many years the government has not been engaging state workers, so the human resources gap is huge. So for them to fill up this gap, it will take up some few years. So we will keep on engaging the government to recruit more health personnel to manage the system. Secondly, the issue of uptake of most of these family planning commodities, the issue of nutrition for the children is also being noticed. So we make sure we engage government to see that they provide most of these products, so that the less privileged, or even the people in the community, will now have access to most of these products.
Notice that we are in the forefront to sustain all the activities of BASAN and other CSOs that we are working with.